Preventing infectious diseases and preventing the spread of those diseases is one of the main jobs of public health. That is a daunting task when you consider that there are over 100 trillion bacteria in our intestinal tract and over 7.2 billion germs on the average kitchen sponge. Even a regular telephone has over 25,000 germs per square inch. Germs are everywhere and in huge numbers. It's like we're living in a germ city. We've developed a lot of antibiotics, vaccinations, and sanitizing and sterilizing techniques and solutions in our attempt to keep us safe and healthy. And these have been quite helpful. Yet we've discovered that the simplest approach is still the best. That is, hand washing is the single most important means of preventing the spread of infection. On today's episode of A Public Health Journal, we're going to talk about hand washing, a low-tech but highly effective way to prevent the spread of disease in our germ city. This is a topic that is important to every one of us, so please stay tuned.
Welcome to A Public Health Journal, a program that explores public health issues facing our society today and tomorrow. The host of the show is Dr. Ed Ellinger, Commissioner of Health for the state of Minnesota. A Public Health Journal is sponsored by the Minnesota Department of Health and the Hennepin County Human Services and Public Health Department, all working together towards the goal of healthy people living in healthy communities.
Welcome to A Public Health Journal. Today we're going to talk about one of public health's most basic tools, hand washing. We'll look at why hand washing is so important, and we'll show you the most effective way to wash your hands. Joining me in this discussion is Debra Durkin, a health educator in the Environmental Health Division of the Minnesota Department of Health. Debra has worked in a variety of areas of public health over the years. Most recently, she's been working on food safety issues and has been part of the team working on Germ City, an innovative way to teach people about the importance of hand washing and about the proper way to effectively wash their hands. Debra, welcome to the program.
Good morning.
And it's nice to be able to talk about basic public health on a public health journal, and hand washing certainly is one of those. And I know we've come through the cold and flu season, so people think a lot about when you cough and when you sneeze that you need to cover your cough and hand washing related to that. But are there other ways that we spread disease other than just through coughing and sneezing?
Well, hand washing is really critical in preventing foodborne illness. We have millions of people becoming ill every year from food poisoning, which is the consuming pathogens in their food, and hand washing is really important in preventing those illnesses.
So it's hand washing is important in a couple of different areas, and related to food, I think people probably don't recognize how important food is as a way of spreading disease. And we've got a couple of slides here that kind of give people a little background on that, because I want to make sure. And this is a slide that shows foodborne outbreaks. Tell us a little bit about what we're seeing on this slide.
Well, we're seeing the number of confirmed foodborne outbreaks in Minnesota over this time period. And that means that we have that there are 2 or more people who became ill from the food that they ate, and that the fact that it was a foodborne illness was confirmed by the health department. For each one of those, there are many, many illnesses that we don't hear about or outbreaks that we cannot confirm.
Right, so this number is going up. One is that we're looking a little bit more closely, but it also is really an underestimate of the total number of foodborne outbreaks, because it's a big problem throughout the state.
And the country.
Yeah. And then we have the next slide that shows the kind of the pathogens, that the percent of diseases that are caused by various things. What are we seeing here?
Well, we're seeing that there are many different kinds of pathogens that can be present in food and make us sick. We all heard about the outbreaks of salmonella. We heard about bad peanut butter and jalapeno peppers. But maybe what is little understood is that 50 to 70% of foodborne illnesses are caused by norovirus. That's most of them. And norovirus is feces on hands, on food, in the mouth, or just on hands and in the mouth.
Right. So some of these things, these outbreaks on cruise ships, outbreaks in schools, outbreaks in nursing homes, are a lot of these norovirus?
Most of them are norovirus. It's rapidly spread. Think of the handrails on cruise ships and cabin doors and all these people in a public place. Same thing in nursing homes and schools. Not only norovirus isn't just spread hand to mouth, but if someone vomits, the spray can travel a long distance, and unless that is cleaned with bleach, anyone touching those surfaces or exposed to that aerosol can also become ill.
So is it pretty contagious? Is it easily spread? Or, there are some diseases that are harder, you have to have a whole lot of it, or is this a little bit of norovirus?
Goes a long way.
All right, so is hand washing the way to prevent this? Is that the best protection against all of these foodborne outbreaks in addition to the colds and flus that we get?
CDC says single most important means of preventing infection. Diarrheal illnesses and lower respiratory. So coughs, colds, infections, and foodborne illness. Hand washing is best.
All right, and so do people hand wash? I mean, do most people use hand washing appropriately?
Well, we've had, Minnesota did a little study at the state fair, and about 40% of men and a little more than 60% of women wash their hands after going to the bathroom at the state fair. That's pretty much the same as it is everywhere else in the country.
Yeah. Well, how long has it been known that hand washing is really important? Isn't this back to Semmelweis back a couple of hundred years ago?
Yes, of course. We've known forever. I think we're in a hurry. And so most people do the splash and dash, little water, wipe the hands on the pants, and off you go. I don't think that many people understand that it really takes 20 seconds. It takes friction, and it takes soap, concentration, time, and careful drying to do it properly. Mm-hmm.
Now, I would anticipate that healthcare providers would be a group that would wash their hands a lot. Do they do it well? Do they do it as often as they should?
I don't think so, or we wouldn't have the infection problems that we have in hospitals. Washing in a healthcare setting is a little different, though, than washing at home, in a restaurant, in a school, because the pathogens are different. Mm-hmm. So if I have clean hands and I'm a hospital healthcare provider, I can use foam sanitizer when I go in and out of a room, and that's perfectly acceptable. The sanitizer works on the pathogens there, and it's being used on clean hands. But in most settings, sanitizer is not the instrument. Mm-hmm. Soap and water is best.
Yeah. So depending on where you are, the techniques should be a little different, or the materials used should be a little different. Like at the state fair, where people are going around and they have ketchup sliding down onto their hands from the corn dog, and then they go into the restroom. They probably need soap to get at that, not just water to.
They need soap, water, and most important, they need friction. The water needs to be running. The friction disturbs the soil, and the running water moves it down the drain. Mm. And the sanitizer, which will not work against organic material, if you've got grease, food, feces, blood, or dirt on your hands, sanitizer won't work. So it's for emergencies at the state fair.
Right. Have we done a good job of educating school kids about the importance of hand washing?
They're the best. When a family comes into our Germ City unit at the fair, the little ones can tell you how long to wash. They know to get the thumbs. They know how to cover their coughs. And the parents look on sometimes in surprise. We are teaching them in the schools because the schools know that infection carries rapidly there. And during the flu, our influenza scare a couple of years ago, most schools made a strong effort to get out the cover the cough and wash the hands messages.
Right. Well, we need to take a little break, and then when we come back, then we're going to have a little video about hand washing that you can walk us through, and we'll get into some of the details. So we'll be back right after this message.
Salad on Saturday, fruit on Friday, throw a ball Thursday. Water Wednesday, touch your 60 minutes of physical activity a day and eating well can help get your child healthy. So keep them active and eating well every day. Get ideas, get involved, get going at letsmove.gov. That's letsmove.gov.
Welcome back. We're talking about hand washing, a great public health tool with Debra Durkin, a health educator in the Environmental Health Division of the Minnesota Department of Health. So I assume you use lots of your time teaching people how to teach people about hand washing, right?
At the fair we do.
Okay. Well, and we've got a little video here that we put together, the crew here at the television studio, about washing hands. So let's take a look and talk us through this.
So he has applied soap and is washing his hands, scrubbing in between his fingers, getting the tops and the bottoms. Well, he's only getting the bottoms right now. Now he's doing a pretty good job of hand washing. I'd like to see him scrub those fingernails in his palm because they harbor a lot of bacteria. But he's done a pretty good hand wash. I don't think it was 20 seconds.
All right. So aren't you supposed to sing, Mary Had a Little Lamb or Yankee Doodle or Happy Birthday, something, 20 seconds?
That's what we teach the children. We find something that they can sing in 20 seconds and have them sing while they scrub.
Okay. So one is the water. Does it make a difference if it's hot water or cold water?
No. CDC had a study just a couple of years ago, and they told us that cold water washes just as effectively as warm. But in the real world, people will keep their hands under warm water longer.
Okay, but doesn't that interfere with the soap getting? I mean, if you put soap on your hands and you're washing your hands, it rinses off if you're under the water.
I would prefer to see people do a lot of that scrubbing without the water and then under the water to wash away the dirt and bacteria.
Right. And then friction is really important. You had mentioned, get the thumbs in particular.
Get the thumbs, get under the fingernails.
How do you get the fingernails clean if you don't have a brush?
You ought to have a brush.
Yeah, but you're not going to have that in most
And in
restrooms.
most places you don't. So you scrub those fingernails in your soapy palm, and that'll get out a lot of it. You can use your fingernails to get your fingernails too.
Okay. And does it make a difference what kind of soap?
Plain old soap is best. We would prefer that people not use antibacterial soap.
No, tell me why. Antibacterial kills bacteria, right?
Well, antibacterial soap doesn't do any better than regular soap. It takes good bacteria off the hands as well as bad bacteria. And there's some research, some early research that tells us it may be causing bacterial resistance, and it may be causing the use of antibacterial products may be causing increased allergies and asthma in children. It's just not necessary.
Okay, so you're telling me also that we don't sterilize our hands when we're washing, do we?
We don't need to.
All right, so you're just getting off the additional bacteria. We have normal bacteria on our skin.
Sure.
You want to keep those on there so it protects from other kinds of bacteria?
We don't need to use antibacterial products on our table, on our surfaces at home, on the clothing, or on the hands.
Now, what about paper towels versus the air dryers? Does it make any difference how you dry?
There are some air dryers that work pretty well now. Again, people don't keep their hands in them long enough to get them dry. And if you walk away with wet hands, you walk away with perfect little laboratories for growing more pathogens. So I prefer paper.
Well, I do too, and actually not a scientific sample, but I see places where they have just the hand dryers. People wash their hands less because they don't want to wait around and they're in a hurry.
So they walk away with them wet, dry them on the pants or air dry them. And I would prefer to see hands that are completely dry.
Right. So what about hand sanitizer? You talked about a little bit about it in hospitals, but what about having hand sanitizer in the restrooms instead of using water?
Absolutely not.
Okay, tell us why.
Hand sanitizers are not effective against norovirus. Norovirus causes 50 to 70% of our foodborne illnesses. The bottle says removes 99.9% of bacteria, but norovirus is not, the alcohol is just not effective against norovirus. So we would prefer, if you would like to use it after you wash your hands, or if it's an emergency situation and there is no running water, then use hand sanitizer.
Right, because we're seeing hand sanitizer at entrances to buildings and exits to buildings and in offices. Is it helpful in those kinds of situations?
Well, if your hands are clean, hand sanitizer does add a bit of protection. I don't object to seeing it at the grocery store. We know that the carts, the grocery store cart handles are dirty. Typically, we go to the grocery store with clean hands, not with soil on them. So it can't hurt, but it shouldn't give us a sense of protection, and it is no substitute for soap and water.
Right. So the idea is to wash your hands frequently during the day with soap and water,
right,
and then in between times with hand sanitizer would be
if
the
you
ideal.
wish.
All right. So we're talking a little bit about Germ City, and this is, I know, something that the health department has been doing over the last several years to teach people about hand washing. Tell us a little bit about Germ City.
Germ City, it was a concept developed by Susie Craig at the University of Washington. She was with Washington Extension and the University of Washington State. And Susie created a 7-foot tall, 7-foot long, 3-foot wide, wheelchair accessible black tent. And people have glitter bug applied to their hands.
Right. So this is sort of an example of people kind of coming through at the state fair, various stations that they have. So tell us, kind of walk through what people would do in going through Germ City.
Okay, well, this is kind of an intermediate place because first the lotion is put on, and people are told, we're going to put pretend germs on your hands.
Okay.
This is a mineral oil lotion with some glittery stuff in it that shows up under black light. They go into the Germ City tent under the black lights and their hands glow.
All right, so this is...
So look at all your pretend germs, we say. Now, what could you do if you had that many germs on your hands to get them off?
So all of the light spots are the germs.
Right, so then we send them out to the hand sinks and tell them to do a normal hand wash. Wash your hands the way you usually do, and then come back in and see how effective that was. See how many germs were removed. So they wash their hands. We have foot pump sinks with cold water, so they're not maybe getting the typical hand wash and their long lines, but they come back, and some people have tried really hard and some people have done their normal wash, and they see that they have a lot of soil left under their nails. Typically they don't wash their thumbs, they don't wash the sides of their hands, and they find out that the normal hand wash isn't very effective. So often they want to do it again.
Okay. Well, I want to talk a little bit more about sort of the comments and the effectiveness of this, but we need to take another little break.
Okay.
We'll be back right after this message.
The average text takes your eyes off the road for nearly 5 seconds.
Welcome back. We're talking about hand washing, and particularly talking about Germ City, an innovative way to teach people about hand washing, with Debra Durkin from the Environmental Health Division at the Minnesota Department of Health. So you have people coming through Germ City, this tent-like thing. They put on the glitter germ, they wash their hands, they go in and say, oh my goodness, they didn't do a very good job. What kind of feedback do you get about this experience?
I think our favorite feedback are the people who come back the next year and say, I've been washing much better. Look how well I'm doing now. Most people say we had no idea. We really had no idea that I thought I did a pretty good job, and I see that I really need a nail brush. I see that I don't do my thumbs, or I don't wash up high enough. There's all these germs in my jewelry. So I think it's very eye-opening. And people like it. It's fun too.
So you do it at the state fair. I mean, do you have it right next to the food barn, or?
Well, we were in the Ag Building one year, but now we're in Health Fair 11. So people are coming to do health screening of various kinds.
Now, is the state fair the only place that you use Germ City?
Oh no, we have 2 Germ City units, and they are available free of charge for anyone who would like to use them. They've been used at health fairs, community centers, fire stations, hospitals, restaurants, colleges, and many, many schools around the state.
Give us a little sense of at a hospital, because I'm always interested, because I know that we try to get healthcare professionals to get flu shots, and they don't get them as often as we would like. We'd like them to wash their hands, and they don't do it as well as they like. What kind of feedback do you get in a healthcare setting?
Pretty much the same as we get in the general public. In healthcare, several hospitals have made the Germ City experience mandatory, as it was at Boynton Health Service when we came there. And people know the rules, they know the 20 minutes. In healthcare settings, they've had the training, but there still hasn't been that connection that I know it, but I seldom take the time to do it. So having that hands-on experience is very helpful.
All right. Now, and you've worked, we started out talking about foodborne outbreaks, and you're a health educator, and you talk to people about hand washing. How do food dealers, restaurants, food distributors, how do they train their staff on washing their hands, or do they?
Oh, they do. And it's an important part of the inspection process. Are the hand sinks there? Are they available? Are they being used? Are they unblocked? You can't open a restaurant without the appropriate number of hand sinks, and sinks that are used only for hands. But they have the same trouble, excuse me, that the general public does, finding the time when the restaurant is busy to wash hands at appropriate times. So management is always talking to them. And our health inspectors are always talking to them, because for them, for people who are handling food for perhaps thousands of people a day, it's really critical.
And on some of these outbreaks, do you see that this is from the food server that starts this off, or is it other people, consumers that start some of the foodborne outbreaks?
It is generally someone who was who has been ill, who has had vomiting and or diarrhea, and who has come to work when they shouldn't.
And I suspect in the food service industry there's a lot of turnover of staff, so that it's not a one-time shot of here's how you wash your hands and make sure you do it. You have to do it on a regular basis.
And it's very hard for managers, particularly when they have a large staff and a lot of turnover, to keep that education coming. And
are we getting better? I mean, are food distributors and food restaurants doing a better job of this? Are we seeing that we're doing a better job, or is it something that we have to continue to work on to improve even more?
Let me tell you about Brown Nicollet Public Health. They have a new program that if you want your food license, you come and get educated. And this year they focused on foodborne illness and employee illness and hand hygiene. And when our inspectors went to do a program evaluation, they asked that question in every establishment, and the staff knew the answers. So we have efforts like that going on all over the state, and we really are seeing an improvement.
What else needs to be done to get more people to wash their hands more often and do it better? What kind of things would you suggest that we as a state kind of look at, and what we do at a local level?
I think one of the best things that's happening is that children are getting it, the way they're getting the seatbelt message and the bicycle helmet message, they're getting it from parents and teachers at a very young age. So I have young children, I have young friends who come to my house now and say, oh, it's time to eat, I'll go wash my hands without being asked. If we get them young and make it routine, make it an expectation, then it will carry through into their working years.
And we started off by talking about CDC saying that this is the most effective, preventive measure. Does it, at a national level, are they getting enough support? Are there enough educational materials? Are they making it an issue, and with some funding to go along with it, to get people to wash their hands?
I think that there are several excellent nationwide efforts, and there are worldwide efforts going on. The recognition that that simple thing can make so much difference. We're seeing much more of it on a global as well as a national level.
Yeah. So we'll have to get our Surgeon General to say, here's a prescription to exercise, here's a prescription to stop smoking, and here's a prescription to wash your hands whenever you, frequently during the day.
Absolutely.
Certainly before and after.
Absolutely.
You use the restroom and eat and all those kinds of things. Yeah.
Good idea.
So one last message before we have to go to our close from washing your hands. What would be the one take home that you'd have for parents and kids that might be watching this show?
Hand washing takes 20 seconds. It's worth the time, it's worth the effort, and in one little study, preschool children who wash their hands had 38% fewer colds and infections. Don't you want to do that for yourself and your family?
Keeps you in school, keeps you at work,
Yep.
keeps you healthy. Deborah,
Yep.
Thank you very much. This has been very helpful.
Thank you.
See you at the fair.
See you at the fair.
Right. I'll be back with a closing comment right after this message.
Clean kitchen surfaces, utensils, and hands with soapy water. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
We live in an age where high-tech gadgets are being invented faster than we ever imagined. We have handheld devices that can access information that previously could only be stored in a large library. We have imaging devices that can look far into space and into the recesses of the smallest cell. We have robotic surgical techniques that can repair almost anything that has been injured. We have powerful medicines that can treat some of the most devastating diseases on earth. We have come to depend on technology to treat illness and keep us healthy. Yet some of the most effective ways of protecting and maintaining our health are far from being high-tech. In fact, the best interventions are the simplest. We talked about one such intervention on today's show, hand washing. But consider these other low-tech, low-cost interventions that have also been shown to be great for your health. Walking every day, getting at least 7 hours of sleep, eating breakfast, having a good relationship with someone, breathing deeply. All of these and many more things have tremendous health benefits, yet don't require any technology. Dolly Parton once said, quote, "It costs a lot to look this cheap," end quote. Fortunately, it doesn't cost a lot to stay healthy. So wash your hands before you pick up your smartphone to call someone you love. That's all for today. Thanks for watching. I hope you can join us again next time on A Public Health Journal.